White, the Director of Radiology Services here at Cody Regional Health. Right now we're standing in our nuke med department. This scanner is about 10 years old and it's supported the organization and our community for quite some time. It's been a workhorse in the nuke med arena and has supported our cardiac program, our cancer patients, and a variety of other patients throughout our community in the Basin Center. We've been approved by the board to replace this unit. Our nuke med camera is about 10 years old. X-ray equipment usually lasts for 8 to 10 years and then you have to replace it. Now's a good time for us to replace with modern technology that allows us to take care of our patients faster and provide better image quality for our providers. Our new nuke med camera will be a GE NM830. It'll provide faster scan times, reducing the amount of time that the patient lays on this table up to about 60%. So that helps our patients from a comfort perspective. An exam that might have taken us 30 minutes now only will take us about 15 minutes. In addition to that, the sensitivity level on our new GE camera will provide increased image quality for our providers, specifically our radiologists who read the exams. That'll help them catch lesions and other pathology in the patients to allow our patients to seek treatment faster than they usually have. So the project is expected to take about 2 weeks. This has taken several months of planning to get to this point. We expect to deinstall this unit on March 29th. It'll be powered down completely. It will be removed from the organization on the 30th of March. The following week, GE will come in and they'll install the new camera, calibrate it, get it all ready for use. And then the week after that, which is April 12th, we will have GE Applications, an individual that's specifically trained on this unit to teach our team how to run it. That'll take a full day, about 8 hours, and then the following day we will go live with patients. And we will have that applications individual here for 4 days to support our team in the learning of this new camera. I'd like to thank our communities for your continued support of Cody Regional Health, especially the radiology department. We appreciate your patience during this couple-week transition, allowing us to get better technology to support our community. Again, we really appreciate the community and all your support.